Ladies and gentlemen,
And welcome to Discoveries in Health. We're just getting started. And thank you for joining us. Hi, Angela. And hello to Prophet Elijah. And let's do a few more things in the background here. It's not allowing me to get into my camera. Maybe it will. And screen. Oh, yeah. Oh, yes. Oh, yes. Still does not want to let me in. That's an H. That's an H. Okay. And
This call may be recorded or transcribed.
And welcome to Discoveries in Health. We're just getting started. Thank you. And hello, everybody there on Dial Pad Meetings and YouTube and Zoom. Thank you for joining us. Mute all the microphones here on dial pad. That's done. All right. And it's working. Let's get over here. All right. That's just about right. Okay. And thank you for joining us here on Discoveries in Health Discussions. Every Thursday, we're here praising the Most High God and helping people to understand how to use natural remedies and which ones are used successfully. And that's what we discuss. Natural remedies. We don't prescribe, we don't diagnose. We're not here selling products. We are here helping people to understand about natural remedies. And we do research on the spot right here. When you ask us a question about a natural remedy, like what is used for diverticulosis, was a question that one person asked. And we'll be talking about that. We'll be visiting with Prophet Elijah and getting an opening prayer. And at the end of the broadcast, we'll be getting a closing prayer. So please stay with us as we are just getting started here. And that doesn't need to be there. Okay, so we're back over here. We're back on the screen. And if you have any questions, any comments, any suggestions, please share that with us here. Just ask your questions. We don't prescribe, we don't diagnose, we don't sell products, but we answer questions. Whatever your questions are, we answer them. So please know that all you need to do after the opening prayer is to press your star key. If you're in dial pad, press your star key 2 times and open your microphone to ask questions or make comments regarding what it is that you would like us to teach here today. And okay, we are going to get out of there. All right. And we'll pick up another over here and this over there. All right, let's get started. Let's get over to Prophet Elijah and get an opening prayer. And Prophet Elijah, are you there, sir?
Yes, sir. I'm here and contagiously blessed and healthy. What about you?
I am also contagiously blessed, and I know that you're contagiously blessed as well. Could you please lead us in an opening prayer?
Yes, sir. 1 Peter 5:8. Be well balanced, temperate, sober of mind. Be vigilant and cautious at all times, for that enemy of yours, the devil, roams around like a lion, roaring in fierce hunger, seeking someone to seize upon and devour. Heavenly and gracious Father, help us to recognize you as the man of war, and for us to be warriors for Christ. Help us to understand the law of blessing and cursing. Give us your wisdom and work through us to win the war of the ages. Forgive us for wrong thoughts and actions against those who have wronged us by their witchcraft or wickedness, whatever it may be. We bless them with all spiritual blessings. Help us to have faith and trust in you and not in man. Dr. Burris and I, Prophet Elijah, take authority over Satan according to the whole word of God that would attempt to get a foothold in Discoveries in Health, Good Shepherd Ministries, Better Health Herbs, and Word of Life Ministries, including the lives of the listeners today. We completely break free from any practices that is unholy, ungodly, including all soul ties with those who have controlled us. Thank you for delivering us from the demons that came in through an open doors of association, and so be it.
So be it. Thank you very much for that prayer. And folks, you want to be sure and stay tuned, or come back if you have to leave. Come back in for the closing prayer at the end of the broadcast, where after that, we open up all the microphones and we all praise the Most High together. What is on your mind today, Prophet Elijah?
Well, today I'm bringing forth a good report. The report, the Most High God wants you well. Everybody that's listening, he's talking to you today. And what he's talking about today, he says, since Jesus bore our sickness and disease, just as he bore our sins, he would no more put sickness on us than he would lead us to commit sin. We have been redeemed from sin and sickness. Scriptures clearly state that sickness is a curse. It's not a blessing sent by the Most High God. Sickness, and said again, sickness is a curse. The fact that Scripture consistently calls sickness a curse and not a blessing, again, confirms the fact that God wants you well. Deuteronomy 28 is a classic chapter on blessing and cursing of the law. Imagine drawing a line down the middle of a chalkboard. On the left side, write the blessing, listing everything in verses 1 through 14. On the right side, list the curses, everyone in verses 15 through 68. You would find multitudes of sickness listed on the curse side. In fact, Deuteronomy 28:61 says, every sickness and every plague which is not written in the book of the law was a curse because of disobedience. Scripture clearly states that sickness is a curse. It's not a blessing sent by the Father to teach us something, as modern Christianity has taught. Once again, sickness is a curse of the law, as we see in Galatians 3:13. Christ has redeemed us from the curse of the law, being a curse for us, for it is written, curse everyone that hangeth on a tree. Why doesn't everyone believe in divine healing? I don't know anyone who wants to be sick. Everyone should want to be healthy. This is evident by the huge amount of money that flows into hospitals, doctors, surgeries, and pharmacies. People will do just about anything to retain or regain their health. It's universal and one of the strongest desires of every person who has ever lived. That's because mankind was created by God to live forever. There is a God-given aversion, dislike in every one of us to sickness, disease, and dying. The Most High God did not create us to be anything less than perfectly healthy. In Proverbs 14:12 and 16:25 says, there is a way which seems right to a man, but the end thereof is the ways of death. Death, including sickness, was our choice, not the Most High God wants us well. Then why is it that so many believers are opposed to divine healing? Our modern culture has become obsessed with refusing to accept personal responsibility rather than admitting our faults and our overcoming them. We blame others. Our insecurity causes us to reject any blame for our problems. It's easier to believe we suffer sickness and are depressed because of chemical imbalance and bad genes. The carnal church has brought the same lie. I quote, it couldn't be our unbelief that keeps us from receiving from God. It must be the Most High God who doesn't want us well. We have developed elaborate theology that places the blame in the wrong place. It is a commonly taught that God wants us sick Why then is he called the great physician? It is said that this is the way he teaches us and builds our character. That is absolutely true. Today, there is not a single reason for anyone to be sick. We are to place the blame on ourselves for lack of faith in the healing anointing and the power of herbs and teas and tinctures and salves like the ones Dr. Truman developed through extensive research on the subject of botany. There are people who complain about aches and pains, but do very little to listen to what the body is saying. Yes, it does speak to you, just like you tell you when it's time to eat, even if you are not hungry, when it's time to take your medication, and so forth. We have terrible habits. We were created with a built-in mechanism to tell us when something is wrong and an innate ability to know how to heal ourselves. The body can and will heal itself of cancer, back pain, cataracts, spider bites, heart disease, epilepsy. The best way to experience health is to be still and listen to the small voice crying out to be heard. Healing does not come through hearing chaos and noise. It only comes through peace. And after the earthquake, or fire. But the Most High God was not in the fire, and after the fire, a sound of gentle stillness and a still small voice. Healing is for now. The Most High will meet us where we are. But his best is now, not tomorrow, but now. Now faith is. Faith must believe that God is, not that he was or going to be. Faith is now. We have to aggressively take the authority that has been given us and bring that healing and manifestation that should not have no doubt for your healing. So be it. That's it, Dr. Bird.
So be it. Thank you.
And I have a question. I have some statement I want to say because I got bit by a brown recluse spider. Recluse spider. I got bit by it. And the toxin was coming from my wrist going towards my heart. And my wife and I knew about a plantain. We took the plantain and put the plantain on the blue recluse spider, one of the poison spider there is. And that night, that plantain we put on was just as black as night. It sucked up all of the poison. And I was told that if I hadn't done that, I would have died because that toxin from the spider goes directly to the heart to kill you. So I'm just letting you know, when certain things you have knowledge of, you use it, God will keep you alive, but you got to know what to use. And by listening to Discoveries in Health, Dr. Verse, you have all the information available for anybody that wants to know how to stay healthy and living well. That's it.
Wow. Wow. Well, that is it's a good thing that you knew what to do, because there's a lot of different remedies. And you say you use plantain, is that right?
I use nothing but the plantain. My wife took it, we took it and rubbed it in our hand and liquefied it and put it on the poison, what it was, and put a Band-Aid around it. We put the fresh leaf, because we had the fresh leaf grows in our yard. See, people don't realize plantain just grows in your yard abundantly, and you have no idea what they're used for. But anyway, if I hadn't known about the plantain, I'd have been dead today. And I'm 77 years of age now, and that's been 5 or 6 years ago.
Wow. Well, you just you got me looking at other remedies for spider bites. Maybe that's something we should talk about. But the one you used and the fact that you knew about plantain and the use for that, that's a blessing. And that just shows how important it is for people to learn about natural remedies, because I just had another person tell me they got a spider bite and it almost killed them because they didn't know what to do and didn't do anything, and now they're suffering. So this knowledge can save people a lot of pain and suffering, and possibly even sometimes death. So, wow. Let's talk a little bit about spider bites, okay?
Yes, sir. And see, and then I didn't realize until we began to do research on the brown recluse spider, is that when it bites you, it automatically to go to attack the heart.
Yeah.
And I'm looking at it with my own eyes, seeing it come up my arm, going toward my heart.
Yes, that's right.
And all night, and when I woke up the next day, that plantain was it was so dark, all that poison was collected in the plantain.
All praises to the Most High.
Yes.
Wow. Okay, are you ready for me to talk a little bit more about bug bites and spider bites and things?
Yes, go right ahead and enjoy yourself. What you do best. Do it great.
Okay, I will. All right. Thank you so much. Thank you, Prophet Elijah. And by the way, Prophet Elijah's telephone number is 334-868-3881. I'll say it again. You got your pen ready? 334-868-3881. That's Prophet Elijah's telephone number. You couldn't pick a better prayer partner. And let's get started here. Well, my telephone number is 503-362-5899. That's 503-362-5899. My email address is Truman, TRUMAN, at herbalhealthreview.com. Truman at herbalhealthreview.com. Please email me. Let me know how I can help. I'm glad to help. Bug bites, like bug bites, spider bites. Oh, wow. Those things can be deadly. They can harm you. And they're far from desirable. You don't want to be bit by a bug, a spider, especially a poisonous spider. But spiders are typically just a nuisance, usually. But in fact, most of the time, spider bite treatments can be done in the comfort of your own home using natural remedies. While other times, especially if a more threatening type of spider bit you, like a brown recluse spider, these spider bites can be a lot more serious, and they are. Unlike mosquitoes that feed on humans, spiders pretty much only bite us as a defense mechanism because they are either feeling threatened or trapped. But no one really cares about why a spider bit them once they're dealing with an annoying, inflamed, itchy, and painful bite. I'm sure you're ready to learn some of the best options when it comes to natural treatment for spider bites, including essential oils, as well as common items you very likely have in your own home. First off, your risk of being bitten by a specific type of poisonous spider varies depending upon the state that you live in. For example, living in the southwestern United States makes you more likely to come in contact with a black widow. Even spiders known for having a more serious bite don't go around just looking to bite people. Spiders have venom to kill their prey. If a spider bites a human and injects its venom, it's typically because they disturbed the spider's living area or they made the spider feel trapped. If you're looking to avoid spiders, well, then you want to be extra careful in sheds and garages and wood piles and with empty containers like those used for gardening. Also outdoors, you're more likely to find spiders inside of a tree, inside of tree stumps or under rocks. Indoor areas are somewhat notorious for hiding spiders, and the spiders include places that tend to be untouched and out of sight. For example, they might lurk behind dressers, bookcases, basement and attic clutter, or those kitchen cupboards that you rarely go into. What causes a spider bite? The obvious answer is a spider. But the unwanted symptoms of a spider bite are specifically caused by venom injected into you by a spider. And however, the severity of your spider bite symptoms will depend upon the exact type of spider that bit you, how much venom that spider injected, and how serious your body is, or how sensitive your body is to the venom. What does a spider bite look like? Well, like bug bites, a spider bite looks like an inflamed reddish bump. And general spider bite symptoms, inflammation, redness, mild pain, itching. And how bad your spider bite symptoms are depends on what kind of spider bit you, how much venom was injected, and your body's individual reaction to this venom. For more specific and more serious spider bite symptoms, such as symptoms of a black widow spider bite, a brown recluse spider bite, or woof spider bite, you want to check. We'll give you some more information on that as well. So let's go there right now, and we'll talk about those treatments. And let's get down here. Sometimes you get a bug bite and you have no idea what on earth bit you. Could it be a mosquito? Or was it a spider? Wait, a spider can bite? Yes, unfortunately, spiders can bite. They can bite you, and they often strike when you least expect it, like when you're sleeping. A spider bite, or arachnidism, is defined as an injury resulting from the bite of a spider. All spiders have fangs, and most also have venom that enables them to kill their prey. However, only a select group of spiders have fangs that can break through the skin of humans and inject venom that can possibly cause harm. Spiders that fall into this risky to humans category include black widow, wolf brown recluse, and hobo and camel spiders. It's really helpful to know the symptoms of a spider bite, because if you know spider bite symptoms, then you can choose the right course of treatment. Additionally, not all spiders are created equal. Depending on the type of spider that bites you, the spider bite symptoms can range from very mild to outright poisonous. What does a spider bite look like? What are the symptoms of a brown recluse spider bite? I'm about to tell you all about specific spider bite symptoms to look for, and also how to treat a spider bite at home using natural remedies. When it comes to spider bites, there are several options for the spider behind the bite. There are actually somewhere around 40,000 different species of spiders around the world. For an adult human in good health, only around a dozen of those thousands can cause major harm. In the United States, the black widow and the brown recluse spider are two of the top concerning spiders when it comes to spider bites. The good news is that Serious medical complications and deaths from spider bites are not very common. Generally speaking, spiders don't go around looking to bite humans. When a spider bites a human, it's almost always in defense. How so? Well, when a spider gets caught between an object or surface and your skin, when it feels trapped, and it's more likely to bite. For example, if a spider's in your boot, you haven't worn it in a while, and you put your foot into that boot, well, then the spider is now trapped between your foot and the boot's interior. The spiders can possibly pose a threat to you. Well, they vary depending on the state you live in. I recommend familiarizing yourself with the appearance of threatening spiders that you may possibly come in contact with at some point in your life in the United States. Some of the spiders to watch out for include the following: the black widow spider, the brown recluse spider, the red widow spider, the hobo spider, the mouse spider, and the wolf spider. The black widow, and anybody who would like a copy of this article with pictures of the spiders and all this information, I am glad to make sure you get it. My email is Truman, Truman, at herbalhealthreview.com. Truman at herbalhealthreview.com. I'll make sure you get a copy of this article with the pictures of all the spiders. So the black widow, black and plump, with a red hourglass figure on the underside of its abdomen, most common in the southwestern United States. The brown recluse, 6 eyes and a violin shape on its back. The brown recluse has 6 eyes and a violin shape on its back. Most common in the South and Southern and Midwestern United States. The wolf spider, brown, gray, black, or tan with dark markings. They have 2 eyes on the front that are much bigger than their other 6 eyes. Wolf spiders are found in almost every country in the world, and they are most common in grasslands and meadows, but also live in other areas. Spider bite symptoms. A lot of times it's hard to know what type of spider bit you, because you may not notice the bite until hours after it actually happened. It can also be hard to tell a spider bite from other types of bug bites. So what does a spider bite look like? In general, a spider bite looks like most bug bites: a red and inflamed bump, a red and inflamed bump. Like other bug bites, a spider bite is also typically itchy and or painful. The degree of intensity of spider bite symptoms depends on the spider type, the amount of venom injected, and your body's sensitivity to the venom. The general symptoms are redness, inflammation, itching, and mild pain. The house spider is a generic term that describes a variety of spiders often found in human dwellings. House spider bite symptoms may vary depending upon the specific type of house spider behind the bite. A black widow spider is, well, what happened here? Let's see what's going on. Yes, hello. I'm doing a 2-hour broadcast right now. Would you like to join me to answer any questions for you? Hello. Well, I guess I lost that. Okay, well. Hello, can you hear me?
Yes, I can. Can you hear me?
Yes, I'm doing a 2-hour broadcast right now, helping people all over the world. Would you like to join me?
Okay.
Okay. to join it, if in the dial pad meetings room, all you need to do is dial up the telephone number 503 503. Then after the 503, it's 606 6064.
606?
Yeah, 503
Oh,
606 6064. 503 606 6064. Just dial that number, and then it might prompt you to dial, press a 1 or something to come into the room, and you're in the room, and I will see you there. Okay?
okay.
Thank you. Thank you very much.
Thank you.
All right. Okay. Pick up the call. All right. And I'll look to see when that lady comes into the room. So we're talking about a black widow spider, which is plump and black with red hourglass figure on the underside of its abdomen. And the black widow spider bite symptoms can include pain and burning at the bite site. That typically starts within an hour of being bitten by a black widow. Pain mainly located around the bite area, but it can spread into the chest and the back of the abdomen. And thank you for joining us there. You just called, and I see you in the room, and we're describing spider bites and what to do about it. During the opening prayer, Prophet Elijah had mentioned that he just was recently bit by a brown recluse spider, and he had the presence of mind to get some plantain and put a plantain poultice on it, and that spider bite venom was traveling up his arm. It's on its way to his heart and would have killed him. And but he got that plantain on there, and he saw it traveling up that venom traveling up his arm, and it stopped, and it went back, and that plantain pulled. It pulled all of the venom into the plantain, and Prophet Elijah is alive and well, and gave us a wonderful opening prayer here today, and we're grateful that he knew what to do. He didn't even need to call me, because he's a doctor as well. He's a naturopathic doctor. He knows what to do, and he used plantain. And there's a lot of different remedies that we can use here, but that's how we got started talking about spider bites. We're also going to talk about diverticulosis, because someone asked for me to talk about diverticulosis. So we're going to talk about that as well, and describe what that is and how to deal with diverticulosis. But right now, we're learning how to deal with spider bites. And we're explaining the information for you. So we're talking about the black widow spider and the pain and the burning at the bite site. That typically starts within an hour of being bitten. And the pain mainly located around the bite area, but it can spread into the chest and back or abdomen. And the abdominal cramping or rigidity. It can cause abdominal cramping or rigidity so intense that it may be mistaken for appendicitis or a ruptured appendix. Increased sweating and saliva production. There'll be a headache with that black widow spider bite. There'd be a headache, a high blood pressure, nausea and vomiting and numbness and restlessness. Now, what happens when a brown recluse spider which has 6 eyes and a violin shape on its back, and that brown recluse spider bite symptoms can include pain and itching that increases within the first 8 hours of being bitten. A bite that looks similar to a bullseye with a central blister that
Baby,
scabs.
God is, I'm telling you. I'm
Uh,
telling you. No, 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 no. No, no, because
Hello.
that destroy his whole life.
I'm hearing you, Prophet Elijah. I'm going to mute your microphone. Okay, there you go. And now you got your privacy. So the pain, it's going to increases within the first 8 hours. The bite looks like a bullseye with a central blister that scabs and falls off, and leaving a small ulcer. There is generally a fever, chills, body aches. Bites can heal on their own within 1 week. Sometimes the skin at the center of the bite can become dark, blue, purple, and turn into a deep open sore that enlarges as the surrounding skin dies. This ulcer usually stops growing within 10 days after the bite, but the full healing can take months. The death of a sizable area of skin, it's called skin necrosis, and resulting in a deep scarring ulcer. And children may be at risk for an allergic reaction to the venom. And that's brown recluse spiders. Let's talk about wolf spiders. Are usually brown, gray, black, or tan with dark markings. They have 2 eyes in the front and that are much bigger than their other 6 eyes. And the wolf spider bite sometimes can include a bite that tears the skin and causes pain, redness, and swelling. There would be swollen lymph glands with the wolf spider bite. Healing can take up to 10 days. In rare cases, the bite can cause tissue damage. Spider bite risk factors. The risk factors of a spider bite are dangerous. Spider bites are not common in the United States. However, some things can increase your risk of being bitten by a spider. As I mentioned earlier. And your risk of specific kinds of spider bites depends upon the state that you live in. And for example, black widow and brown recluse spiders both prefer warm climates and dark, dry places. Spiders don't typically look to attack humans, but a major risk factor for any spider bite is disturbing the area in which they live. If you live in the southwestern United States, then you are more likely to come in contact with a black widow spider. Some areas to watch out for include wood piles, garages, sheds, and unused gardening pots or other containers. Another spider that is dangerous to the humans in the US is the brown recluse spider, which is the most prevalent in some areas of the South, as well as in the southern Midwest, where are you most likely to find a brown recluse spider hiding? Likely possibilities include areas that don't get a lot of traffic, like cupboards you don't often use, behind dressers, in the clutter of attics, and outdoors under rocks and inside tree stumps. Conventional bite treatment, according to the Mayo Clinic, most spider bites don't require medical intervention. Conventional recommendations for spider bite treatment typically start off with cleaning the spider bite and applying an antibiotic ointment. Next, apply a cold compress and elevate the bite site. Elevate the bite site. And if it is on an arm or leg, conventional wisdom will also recommend taking over-the-counter painkillers like NSAIDs and antihistamines if you're into that. But if you know better, then you find natural remedies that are natural pain killers. You don't need to reach for the NSAIDs or the antihistamines like Benadryl. But you're going to use what you have on hand and what you can get your hands on. And you're going to use what as needed, and you're going to watch out for spider bite infection symptoms. If the spider bite becomes infected, then the antibiotics will be recommended. And there are a lot of great antibiotics. One of the greatest one is number 1018, Antibio, with echinacea, golden seal, procruit, and cayenne. That is a powerful natural antibiotic that would be beneficial in this time. If the spider bite becomes infected, then antibiotics will be recommended. And the more serious spider bite, such as one from a black widow that is causing life-threatening spider bite symptoms, your doctor may inject you with an antivenom or give you the antivenom intravenously. Antivenom sometimes causes intense allergic reactions. So some of the things that you can, the treatments are ice, baking soda, elevate the area, especially if it's a foot or an arm or a leg, you can elevate it. And don't scratch it. It's going to itch, but don't scratch it. You want to use things like lavender essential oil and witch hazel. 6 spider bite treatments. How long does it take to recover from a spider bite? This depends on what type of spider bite or what type of spider bit you, as well as your body's specific reaction to the spider's venom. However, the majority of the spider bites tend to go away in about a week. And treating a spider bite at home is usually sufficient. With mild and typical spider bite symptoms like localized pain, itching, and inflammation, these natural spider bite remedies are just the ticket to for relief. Of course, if you know you have been bit by a poisonous spider, such as a brown recluse or a black widow, then by all means, head straight to your doctor. If your spider bite is not serious, there are some great ideas for natural treatment at home. Ice, for most spider bites, the first step is always to clean the bite with soap and warm water, then immediately apply an ice pack to reduce the swelling. You can do this on and off for about 10 minutes, 10 minutes on, 10 minutes off with ice. Repeat icing several times a day, especially in the beginning. This is both a conventional and a natural treatment of spider bite symptoms. Ice. Baking soda, a paste made of baking soda and water. Applied several, I have an open mic somewhere. I don't know where it is. Oh, it's over here. Okay, hi there. In area code 904, we're going to mute your mic. Okay, thank you for joining us. And you want to elevate, if possible, elevate the area. You want to elevate the area of your body where you have a spider bite to help reduce the swelling. For example, if you have a spider bite on your leg or your arm, then you should elevate the affected limb. Okay. But a paste made with baking soda and water applied several times a day can really help with itching of a spider bite. Don't scratch. Avoid scratching the spider bite area. This helps to reduce the risk of infection. Plus, the more you scratch, the redder, the more inflamed, and the more itchy the bite becomes. So if you scratch it, it gets worse. Lavender essential oil. Applying lavender essential oil to a spider bite can help soothe inflammation and speed up the healing process. And add a few drops of lavender oil to a carrier oil like coconut oil. And you dab this lavender oil and coconut oil, you dab it into the spider bite wound. And the sooner you apply the lavender oil, the better it will be to reduce the unwanted spider bite symptoms. Witch hazel as a skin healing astringent. Witch hazel is the perfect topical liquid to apply directly to a spider bite as needed to reduce the redness and irritation. Witch hazel. Is it really a spider bite? If you think a poisonous spider bit you, then by all means seek medical care immediately. But I do want to point out some interesting research that demonstrates how spider bite symptoms are often not caused by a spider or even another bug at all. A study found that out of 182 patients in California who thought they were experiencing a spider bite symptoms, only a mere 3.8% actually had been bitten by an actual spider. Only 3.8%. Wow, that's not very many. That's only out of 182 people. That's only about five or six people. So yeah, that's not very many out of that were actually bit. So anyway, so what was the cause of their spider bite symptoms? Over 85% of the patients were diagnosed with infections. One type of infection that has been known to be confused with a spider bite is a methicillin-resistant Staphylococcus aureus infection, more commonly known as MRSA, M-R-S-A, MRSA. In addition to bacterial infections like MRSA, there are a few other things that people have been known to confuse with spider bites, including bed bug bites, flea bites, poison ivy, and other allergic reactions. Perhaps even more disconcerting, there have been cases of Lyme disease caused by tick bites, misinterpreted as brown recluse spider bites. Neither is a condition anyone wants to have, but it's important to get an accurate diagnosis if you're unsure about a spider bite. You want to be sure to have it carefully examined by your healthcare provider. Precautions, symptoms of a poisonous spider bite are definitely something to take very seriously. If you or a loved one experience worrying spider bite symptoms, then seek medical attention immediately. Serious spider bite reactions or death due to a spider bite are rare. It's a rare occurrence, but occur most often in children, the very ill, or elderly individuals. Prompt medical care is recommended if any of the following are true. The person who has bitten has trouble breathing. The person who is bitten has severe pain, abdominal cramping, or growing ulcer, or a growing ulcer at the bite site. If the bite area gets continually worse or spreads after applying basic first aid, that's when you got to have prompt medical care. If it spreads, and if you're not sure if the bite was from a poisonous spider, let's get some medical attention and make sure what's going on. And on rare occasions, a spider bite can cause an allergic reaction called anaphylactic shock. Anaphylactic shock, which can be fatal. Dial 111 or get emergency medical help if you or someone you know is experiencing any of the following: rapid swelling of the lips, tongue, throat, or around the eyes, difficulty breathing, wheezing or shortness, wheezing or hoarseness, severe itching, cramping, or numbness, dizziness, a reddish rash or hives, stomach cramps, or loss of consciousness. You want to dial 911 immediately. Keep an eye on bites as it heals. Be on the lookout for spider bite infection symptoms such as increased pain, swelling, or redness, as well as fever, swollen glands, or other flu-like symptoms. And some final thoughts on these spider bites. Like bee stings and other bug attacks, spider bites are not pleasant. Thankfully, most spider bites are not serious and heal within a week using basic home remedies. Spider bite symptoms can really vary. If you don't know what kind of spider bit you, then the symptoms may hopefully help clue you in to the type of spider behind your bite. However, sometimes spider bites may be confused with other bug bites or even infections. It's important to always seek medical care promptly if you are unaware that you are dealing with, if you're unsure of what you're dealing with, or if you know a more dangerous spider bit you. So anyway, that gives us some information about spider bites, which we have never covered before. And because Prophet Elijah was bit by a brown recluse spider and had the presence of mind to use plantain, he knew what to do. He did it, and he's well, and here on the broadcast, no problem. All praises to the Most High.
Dr. Birch.
Okay. All right. Thank you. And does anybody have any questions, topics, or suggestions? If you have something that we should cover, let us know. Unmute your microphone and let us know what it is that you would like to learn today.
Dr. Birch.
Yes, go ahead.
This Prophet Elijah, I just want to conclude about the spider that bit me. It was amazing how when it bit me, the toxin was going up my arm like a thermometer, red.
Yes.
All the way up, all the way down my vein. It was just red.
Yes.
Going toward my heart.
On its way to the heart. Yes, it was.
Right. And then when I put the plantain, we put the plantain on there. And then we began to drink the golden seal and burdock root and red clover. And it was like a thermometer going nice, going down, back down to my wrist where it came from. And about a week, it was over. No fevers, no nothing. Life was just, but it was amazing because I was supposed to have been dead.
Yeah. Yes. It sounded like it was a very serious situation and you didn't have time for mistakes.
No, because when it bit me, I was asleep.
Oh, wow. Wow.
I was asleep.
That's no fair.
that was a rude awakening. You can believe that.
Absolutely. Yeah.
And between my wife and I, and the Most High God, we conquered it. He is our healer, and He did a miraculous thing in my life. And I can tell anybody that when you put your hands into His hands, your life into His hands, He does miracles.
Yes.
And that's it.
Yes, sir. Okay. All right.
And you did a thorough service when you were talking about the spiders. Because many people probably would never have known this if we hadn't talked about it. So at least this is knowledge that most people never would thought of.
Yeah, there
so was. You're a blessing.
See, we turned a bad thing into some good information to help other people.
Don't you always do that every Thursday? That's nothing new, but this is just something new came up today, but that's good. Now let's keep going because I'm enjoying it.
Okay, brother. All right. Thank you so much. And once again, please, anyone who has a question, a topic, or it's okay to interrupt us. I see an open mic over here in the New York area. Do you have a question, topic, or suggestion?
Yes. Hello.
Hello there.
With the formula, Brother Elijah, can you tell us exactly? You said plantain, red clover, was that burdock root, and was that fresh herbs and the plantain? That was something, but you just probably took a regular plant, you mashed it up. Can you tell us the formula?
Well, it was not a formula, it was just the herb, one herb, plantain. Is that right, Prophet Elijah?
Right. It was one herb for the plantain, but then to get rid of everything, I used the golden seal, which is the greatest antibiotic that God had placed on the earth. And then I used the red clover for flushing out all the toxin out of my body. And the burdock root came in to bring the major healing. Now, this was all natural herbal teas that was loose, and we had to heat it up, boil it, and drink it, and that's what happened. And in fact, in 7 days, it was over.
So it was plantain, red clover blossoms, and golden seal root. And was there anything else?
A red clover and burdock root.
Oh, burdock root. There was the fourth one, burdock root. Well,
Burdock root, yes.
oh, well.
Okay. So was that the herbs, the tea? That was the tea that you drank, right? And then the plantain was the paste.
Right. The plantain was the first thing I put on to draw all the toxin and poison out of my body. But at the same time, I was drinking the golden seal for my antibiotic, and then I was drinking the red clover to flush and the burdock root to rebuild my immune system at the same time.
Oh, I see. Mm-hmm.
There we go. Okay, did that answer your question?
Yeah.
Thank you very much for posing that question. And anyone, if you have a question, a topic, or a suggestion, please open your microphone and let's talk about it. And I don't see any other, well, there's a microphone coming open over there. What is your question or topic there over on YouTube? I don't see it there. Okay, all right, I'm gonna leave that. All right, let's go to the next topic. The next topic is diverticulitis, diverticulosis. And let's talk about diverticulitis, diverticulosis. Okay, let's see if we can get that. I thought I had it right here. It's not there. We're going to close that. Come over here. Advance you'll start about it. And diverticulitis, diverticulosis. Let's talk about that because a lot of people. Let's go over here and bring it up. Okay. Diverticulosis. Bring it up over here so the folks out in this room can see it as well. And here we go. So when we're talking about diverticulosis or diverticulitis, okay, and what we're talking about is that in the United States of America, we have about 200,000 people are hospitalized for diverticulitis each year. 200,000 are hospitalized. The diverticular disease can be a painful and upsetting disturbance in the digestive tract. And in severe cases, it can lead to hospitalization and surgery due to complications from diverticulitis symptoms. The food you eat and a variety of other risk factors can increase your chances of developing diverticulitis, especially after the age of 40. Conversely, following a diverticulitis diet and changing your lifestyle habits can help you relieve diverticulitis symptoms naturally. When diverticulitis occurs when you have one or more pouches of or sacs in the wall of your colon that have become inflamed. These small pouches called diverticula, most commonly in the lower part of your colon called the sigmoid colon. They form and push outward through weak spots in the colon wall. When the pouches form, this is called diverticulosis, which usually doesn't cause any symptoms or problems. But when the pouches become inflamed or infected, this can lead to serious complications and hospitalization. When diverticular sacs become blocked with fecal matter, allowing bacteria to build, this can result in an infection and an inflammation. As the sacs grow, they put an increasing amount of pressure on the walls of the intestine, leading to pain, gas, abdominal discomfort, and other diverticulitis symptoms. Diverticulitis symptoms. Although the majority of patients with diverticular disease do not have symptoms, research suggests that approximately 10% to 25% of patients develop symptoms which may range from significant abdominal pain associated with fever and leukocytosis. The increase of the total number of white blood cells, requiring hospitalization to a large portion of patients with recurrent, short-lived abdominal pain that may have significant impacts on their lifestyles. According to research that is published in the Therapeutic Advances in Gastroenterology, about 80% to 85% of people with diverticular disease are asymptomatic. Of the 15% to 20% of the patients with symptoms, 75% of them have painful diverticular disease without inflammation. 1% to 2% require hospitalization, and 0.5% require surgery. That's 0.5%. The most common of diverticulitis symptoms is pain in the lower left side of your abdomen. It's caused by the inflamed pouches, and this severe pain usually comes on suddenly, and the intensity of the pain can change over time, sometimes getting worse over several days. Acute diverticulitis is characterized by inflammation, microperforation, and abscess formation, with 25% to 33% of the patients experiencing recurrent episodes. Other diverticular symptoms include tenderness in the lower abdomen, cramping, bloating, constipation or diarrhea, fever and chills, nausea, vomiting. Those are diverticulous symptoms. About 25 to 33% are experiencing these recurrent episodes. And about 25% of the people with diverticulitis develop complications, which may include abscess, a painful, swollen, infected, and pus-filled area just outside of your colon that makes you feel ill with symptoms like fever, nausea, vomiting, and severe tenderness in your abdomen. Perforation. If there's perforation, which is a small tear or a hole in a pouch in your colon. Peritonitis, that's an inflammation or infection of the lining of your abdomen, which is caused when pus and stool leak through a perforation. There could be a fistula, an abnormal passage or tunnel between two organs, such as the colon and the bladder. The colon and the bladder. Now, it could be intestinal obstruction, a partial or total blockage of the movement of food or stool through your intestines. Risk factors and root causes of diverticulosis. People are more likely to develop diverticulosis and diverticulitis as they age. Research published in the Clinics in Colon and Rectal Surgery, Clinics in Colon and Rectal Surgery, indicates that diverticulosis is common in industrialized nations, and the prevalence increases dramatically with increasing age. Under the age of 30, about 1% to 2% of the patients have diverticulosis, while this condition is found in over 40% of the population after the age of 60. Approximately 10% to 25% of the patients with diverticulosis will develop diverticulitis. Research also suggests that some people ages 50 and older, and women are more likely than men to develop diverticulitis. However, among people younger than age 50, men are more likely to develop diverticulitis symptoms. Other risk factors of developing diverticulitis symptoms include obesity, smoking, lack of physical activity, kind of a sedentary lifestyle, a diet high in red meat and fat and low in fiber. Certain medications such as NSAIDs, which increase the risk of complications of diverticulitis. Diverticulitis occurs when the diverticula, the marble-sized pouches that can form in the lining of your digestive system, they develop when naturally weak places in your colon give way under pressure. This causes the pouches to protrude through the colon wall. When the pouches create a tear in the colon wall, it becomes inflamed or infected, which is called diverticulitis. About 80% to 85% of people with diverticular disease are asymptomatic. About 25% of people with diverticulitis develop complications. Of the 15 to 20% of the patients with symptoms, 75% of the patients have painful diverticular disease without inflammation. 1% to 2% require hospitalization, and 0.5% or 0.5% require surgery. 25 to 33% of the patients have acute diverticulitis, 25% to 33% of patients with acute diverticulitis experience recurrent episodes. Conventional treatment for diverticulitis symptoms treatment for treatment for symptomatic diverticular disease is largely based on the symptoms. Traditional therapy includes fiber, rest, antibiotics, pain control, and surgery for selected cases. And the goal of management of diverticular disease is to treat the infection, improve symptoms, and prevent the recurrence of symptoms or development of serious complications. Mesalamine is a medication that's commonly used to treat certain bowel diseases. This medication works by decreasing swelling in the colon and is used to reduce symptoms such as rectal bleeding, stomach pain, and diarrhea. Rifaximin. Rifaximin is an antibiotic that's commonly used in the treatment of digestive and diverticular conditions. It's typically used to treat travelers' diarrhea and irritable bowel syndrome. Rifaximin. By dropping the growth of bacteria that causes diarrhea. Side effects of rifaximin include stomach pain, nausea, dizziness, excessive tiredness, headache, muscle tightening, and joint pain. Those are the side effects of rifaximin. If you have a severe attack or have other health problems, you'll likely need to be hospitalized. If you experience complications such as, well, let's do this again. If you have a severe attack or have other health problems, you'll likely need to be hospitalized, and a treatment will generally involve intravenous antibiotics and insertion of a tube to drain an abscess if one has formed. If you experience complications such as a perforation, abscess, fistula, or bowel obstruction, you may need to have surgery to treat the diverticulitis. It's estimated that about 15% to 20% of all patients admitted to the hospital with acute diverticulitis, both complicated and uncomplicated, require surgery intervention during initial admission. Those with complicated diverticulitis are even more likely to require an operation during the initial hospitalization, upward of 50% of the time. There are two main types of surgery for diverticulitis. Primary bowel resection removes diseased segments of your intestine and then reconnects the healthy segments, allowing you to have normal bowel movements. If there is too much inflammation to perform a primary bowel resection, then you may need a bowel resection with a colostomy. which involves creating an opening in your abdominal wall that's connected to a healthy part of your colon. Waste then passes through the opening into a bag. Once there is a reduction of inflammation, the colostomy may be reversed and the bowel reconnected. But that's a colostomy. And I think Sister Barbara last week, that's probably what she was really referring to. It was a colostomy last week. Now, natural treatment for diverticulitis symptoms are diet. Over the last 4 decades, researchers have been examining the role of dietary fiber in the development of diverticular disease. Recent research shows that fiber found in fruits and vegetables has the most protective effect. And a high intake of total fat and red meat increases the incidence of diverticular disease. In a health professional's follow-up study encompassing 48,000 individuals with the highest fiber intake, more than 32 grams per day, had a risk reduction of 42% for development of diverticulitis compared to those with the lowest fiber intake. Based on the extensive research regarding dietary factors that are associated with the development of diverticulitis, it is recommended the following guidelines for patients with diverticular disease. Increase your fiber intake to 20 to 30 grams per day. We mentioned MRSA, MRSA, which is a horrible flesh-eating disease. The answer to it is bentonite clay. Bentonite clay destroys MRSA. So a fiber product with bentonite clay, like that number 4837. And again, I don't sell products, but let's look at a fiber product that has bentonite clay in it. I created one. The name of it, Truman's Fiber with bentonite clay. I get nothing from the sale of it, but I invented it, and it's loaded with psyllium husks, bentonite clay, chlorella, spirulina, barleygrass, wheatgrass, acidophilus, marshmallow root, echinacea root, wild yam, Atlantic kelp, shepherd's purse to slow down the bleeding, slippery elm bark, which is wonderful for all kinds of stomach problems, green kamut, and the instructions are 1 teaspoon or more, once or twice daily. That is the best fiber product in the world right there. Number 4837. I'm looking at it on a website, betterhealthherbs.com. And that is a high quality fiber product. I'm going to get nothing from the sale of it. You want to consume nuts, grains, and popcorn. Consume nuts, grains, and popcorn. Oh, where I spider? No, is that right? No. No, I want to get back over here. Where is it? Here we go. So we want to eat more anti-inflammatory foods. We want to increase your consumption of anti-inflammatory foods, such as leafy green vegetables, celery, beets, broccoli, blueberries, walnuts, chia seeds, bone broth, and coconut oil. Inflammation is the main feature of acute diverticulitis. So adding anti-inflammatory foods can help reduce diverticulitis symptoms. Curcumin is another anti-inflammatory herb that reduces inflammation. So let's get some more curcumin. Consume nuts and grains in popcorn. Although people with diverticula have long been advised to avoid nuts, grains, corn, or popcorn because it was believed that the undigested particles would remain lodged in portions of the diverticulum. Recent research shows that the consumption of nuts or popcorn at least twice a week can reduce the risk of developing diverticulitis and diverticular hemorrhage by 20% for nuts and 27% for popcorn. Eat more probiotic foods. Eating more probiotic foods, such as kimchi, sauerkraut, natto. And I'm not gonna, I would not eat yogurt and I would not eat kefir, but there are some people that do. Probiotics should be added to your diet to help negate food sensitivities and relieve digestion issues, such as constipation, gas, bloating. And if you have diverticulitis, you need an influx of these healthy bacteria to aid in the healing of your colon while preventing disease reoccurrence. And if you're not fond of kimchi, sauerkraut, natto, and these probiotics, then make sure you pick up a good probiotic. And that would have like 10 strains of bacteria, and it would be 50 billion in strength. So if you're looking for one in your health food store on the shelf, or you go into your supermarket, wherever, and looking for a good probiotic, look for one that says 10 strains and 50 billion strength. Now you got one that's going to work. That'll do it. That's a powerful one, and that's the one that I take. 1050. So, and if you're eating red meat, stop eating red meat. A case control study examined 86 patients with diverticulitis and 106 controls. 86 patients with diverticulitis and 106 controls. Researchers found that individuals who consumed red meat at least once per day had 25 times the risk of developing diverticulosis compared to those who ate red meat less than once a week. You want to reduce alcohol consumption because a cross-sectional study found that individuals who consumed alcohol have a risk of developing diverticulosis that's 2.2 times greater than the risk of people who do not consume alcohol. And supplements, some of the greatest supplements for diverticulitis, is slippery elm bark. Slippery elm bark powder is a demulcent. A demulcent meaning it protects irritated tissues and promotes healing, which is necessary in treating diverticulitis symptoms, slippery elm bark.
Greetings, Dr. Truman.
Greetings.
This is Sister Barbara.
Hi, Sister Barbara. How are you?
Sister here. I'm going to tell you something. You know what? The Most High God is in this here conference.
No doubt about it.
Sleeping. I woke up and Prophet Elijah was talking about he got bit by a spider. And that was on the news all week. Spiders were biting people left and right. I talked about something last week, and this here, what's that word you saying?
Colostomy.
No.
A colostomy.
No, the topic.
Oh, the
Barbara.
Last week?
No, right now.
Right now.
It's all tied in with each other. Yeah. A lot of older people are getting that. When you were talking about older women.
Yes.
I got a phone call because they kicked the woman out of shelter because of that. She had a bag. And they sent her to a place called Resolve. She had nowhere to stay. She was homeless.
Yeah.
That spider bites are very, this is off the chain.
Yeah.
Because this is what's going on right now at this timeline.
Yes.
The Most High God is using you, Prophet Elijah, and we coming with the topic. And then Prophet Elijah got bit.
Yeah.
The bites are happening.
Yeah.
Wow. I praise the Most High God.
All praises.
Yeah. I just needed to share that.
Yes.
He's using you, Prophet Elijah. He's using you, Dr. Truman.
I'm sorry, say that again. What's that?
The Most High God is using you, a Prophet Elijah.
Definitely.
And this is at such a timeline as it's needed.
Definitely.
Wow.
Yes.
I'm done. I'm blown away.
well, thank you for sharing with us. And again, last week when what you were, I think, referring to, was a colostomy, which is when they have to resection a part of your bowel and then hang a bag there so you can be able to empty out into the bag, which then can be reversed later. But I think that may have been what you were talking about last.
No. I was talking about colonoscopy.
Okay, a colonoscopy, which is then a totally different thing, which is again, take it when they're
colon bag.
Yeah, when they
colon gone.
Yeah, when they insert that tube in there with the and they're looking around inside there to see what's going on. Yeah. Okay, but
see that spider bite. And what I talked about last week and what's talked about today is what's going on at such a timeline like this, like that spider bite.
Yes.
That's been on the news all week.
There you go.
Different spiders bite.
Well, then it's a good thing that we're talking about it. All praises to the Most High.
He's worthy. I'm telling you.
Okay, all right. Let's move on here.
Shalom, Dr. Truman.
Yes, Shalom.
What advice could I give someone that has invasive candida and have had 2 surgeries due to overgrowth?
Invasive candida.
Candida, yes, sir.
Okay, let's talk. We're going to talk about that in a minute. Okay. All right.
Okay.
We will finish with this, and then we're going to talk about Candida albicans. And thank you for that topic. We will do that. Okay.
Yes, sir.
Thank you very much.
All right. Thank you.
All right, and oh, okay, we're good there. Okay, we're good. Okay, we're good. Yeah, all right. Now, going back to the topic here. So we need to eat more anti-inflammatory foods. We need to consume nuts and grains and popcorn. And I do need to come over here and close the microphone because I've got a microphone open over here. We've got there we go. So we're closing that microphone. So, and we need to eat more probiotic foods. And we need to reduce your consumption of red meat. We need to not drink alcohol. And we need to find out about slippery elm bark. And I need to go over here, and I've got a microphone open in Florida. Do you have a question, topic, or suggestion? In Florida, do you have a question, topic, or suggestion?
Hello?
Yes, hello. Your microphone is open. Do you have a question, topic, or suggestion?
Yeah. I've already asked how do I close it?
I didn't get that. Go ahead.
How do I close, cut the mic off?
I did it for you. You're good to go. All right. Okay. Let's wrap this up here.
Dr. Burkle,
And I got another microphone open over here.
I'm sorry.
Let's see. We're going to go ahead and mute that microphone, and we're going to. So we're talking about protein powder made from bone broth. We're talking about slippery elm bark. These are the tools you can use when there's diverticulitis or diverticulosis. A protein powder made from bone broth helps heal leaky gut and the digestive tract. Bone broth also helps you easily digest essential nutrients that your body needs, including calcium, magnesium, phosphorus, silicon, and sulfur. Probiotics. We talked about probiotics. In a 2003 study involving 15 patients with uncomplicated diverticular disease experienced larger periods of remission. And they had improved abdominal symptoms after receiving a probiotic supplementation compared to treatment before. So once again, a probiotic like a 1050, 10 strains of bacteria, 50 billion strength is going to be very helpful when there's diverticular disease. And aloe vera for short-term use. Why do I say short-term use of aloe vera? Because it becomes habit forming. Aloe vera juice, aids in the digestion. It helps normalize the pH levels. It regulates bowel processing and encourages healthy digestive bacteria. And about 12 to 16 ounces of aloe vera juice that does not contain latex, which is rubber, is recommended. But any more than that can further irritate your system. Don't take more than 12 to 16 ounces of aloe vera juice, and don't use it for a long period of time, because then you will not be able to put it down. It's habit forming. That's why I don't use aloe vera, because people then tend to depend upon it. And then they have to depend upon it because nothing works without it. So that's why I don't use aloe vera for any long period of time, maybe 6, 7 days, 10 days max. Licorice root lowers stomach acid levels. It relieves heartburn. And it acts as a mild laxative. which can help you clear your colon of waste, licorice root. It also helps it increase bile, aiding your digestion, and it helps reduce spasms and inflammation in the gastrointestinal tract. Licorice root. And if there's high blood pressure, be careful of licorice root. If it increases the high blood pressure, don't use it. Natural remedies. You want to increase your physical activity. Research shows that increasing exercise may be associated with a reduced risk of developing diverticulitis symptoms, and being overweight is a risk factor for developing diverticular disease. Quit smoking. A cross-section study found that the probability of diverticulosis was 30% greater among smokers. Avoid NSAIDs, aspirin and all these NSAIDs. Avoid them. Research suggests that chronic non-steroidal anti-inflammatory medication use is almost twice as common in patients with diverticular disease as it is in healthy control groups. Diverticulitis precautions. The first step to reduce your chances of developing diverticulitis is to increase your fiber intake. But taking too much fiber too quickly may cause a worsening of symptoms. So let's be careful. Let's start with a little bit of fiber and increase it to the amount that is working for you. Because it can, taking too much of it, too much fiber, can cause worsening symptoms of diarrhea, gas, or bloating. It's better to gradually increase your fiber consumption in order to avoid these digestive issues. Let's go for some final thoughts on diverticulitis symptoms. People are likely to develop diverticulosis and diverticulitis as they age. Other risk factors for the development of diverticulitis symptoms include gender, obesity, smoking, lack of physical activity, a diet high in red meat and fat and low in fiber, and certain medications. Diverticulitis occurs when you have one or more pouches or sacs in the wall of your colon that become inflamed. These small pouches, called diverticula, most commonly in the lower part of your colon, called the sigmoid colon, form and push outward through weak spots in the colon wall. And we've gone over all of this already. So we're going to conclude with that. And anyone who wants any report, just contact me. Email me, truman@herbalhealthreview.com. And my email address is truman@healthherbs.com. Truman@healthherbs.com or truman@herbalhealthreview.com. Truman@herbalhealthreview.com is usually the one that I usually get the most mail.
Dr. Burst,
Yes, go ahead.
can I ask one little question?
Yes.
This is hypothetical. An individual is taking tamsulosin, well, another name is Flomax, for prostate for years and years, and doesn't seem to be really helping. Of course, we know it's probably not. So then that person might ask the doctor, and the doctor would prescribe uroxetrol, which is probably, I don't know, maybe they just don't want to take any more medication.
That makes sense.
So then they would just come off of that, most likely come off of that Flomax and then look for other alternatives other than the Uroxetrel.
Yes, the way that generally happens is they look at that prostate report on herbalhealthreview.com, and they start using the natural remedies for prostate. And a lot of time that includes working with the kidneys, cleaning the kidneys, cleaning the liver, doing a cleanse, and then make lifestyle changes, diet system, and then there's a host of things that help people with the prostate. And if we have time after we talk about Candida, maybe we should touch on what can be used so that they can leverage themselves away from drugs they don't want to take anymore. We'll see if we have time left over in order to do that. I don't think we are. As a matter of fact, we're pushing for time for the Candida. But maybe next week, we then can talk and describe how to work with the prostate to heal the prostate.
Okay.
We'll talk about that next week. But let's get started over here.
Okay, thank you.
You're welcome, and thank you for the question. So now we're going to get over here and we're going to look at Candida albicans because we are running out of time. But we've covered a lot of good information today that needed to be covered. So we're talking about Candida albicans. Candida albicans. Well, a tiny single-celled organism. Candida albicans can cause some big problems. This fungus exists normally. It's a normal fungus in your body and harmlessly. It doesn't do any harm. In the eyes, mouth, intestines, and genitals, you're going to find this fungus exists normally. Unless an overgrowth occurs, toppling the body's normal balance of microorganisms, the resultant infections, which can include oral thrush, diaper rash, and vaginal yeast infections, can be uncomfortable and unpleasant. Alarmingly, and Candida infections, medically known as Candidiasis, are becoming increasingly resistant to conventional drugs. And I talked about this some 60 years ago. I was explaining to people that the conventional drugs are causing resistance to the Candida is becoming resistant to and a lot of other diseases, infections, and so forth because of the overuse of conventional drugs, antibiotics. They used them when they shouldn't, and it killed some of the bacteria and made others stronger. So it eventually has created these medically resistant drugs. So the drugs no longer help them. They got nothing for them now. And they are responsible for having created stronger, worse bacteria, funguses, and viruses because of their ignorance. What causes Candida? Anything that disturbs the normal balance of the microorganisms can put you at risk of Candida overgrowth. Eating too much sugar, drinking too much alcohol. These are some of the primary things that happen. Smoking, all of these things predispose you to having a problem with Candida albicans. The use of antibiotics and steroids, emotional stress, environmental factors are common causes of Candida. Being overweight also increases the susceptibility of Candida. The primary cause of Candida seems to be a weakened immune system. Hence, the Make Lifestyle Changes diet system on herbalhealthreview.com is crucial because it will keep people healthy. It will make people healthier. It will help people to get over health disorders when they go on the Make Lifestyle Changes diet system and get their diet corrected. When they've got a power diet, then they got energy. Then they can overcome things that they never thought they could ever overcome. And maybe the medical establishment will tell them, you're never going to get over this. But when they make that dietary changes and they use prayer, you can expect results. Anyway, they're estimating that 90% of all people with HIV and AIDS will develop Candida infections and other infections from a weakened immune system. So the Make Lifestyle Changes diet system is an absolute must if you want to be super healthy. So what do we do when there's Candida? You find out about colloidal silver water and you consume 16 ounces of it daily until you don't have Candida anymore. You find out about that CVF Be Gone number 1126 was a cold virus flu formulation that really hammers Candida albicans overgrowth. That will and antibiotics like that Ant B that we mentioned, number 1018, echinacea, golden seal, pokeroot, and cayenne. That is a powerful, powerful natural antibiotic combination. Whether you're battling full-blown Candida overgrowth or simply want to prevent future infections from occurring, herbs are a powerful tool for naturally keeping Candida at bay. And here's a list of, and here's that probiotic 1050 that you need to be taking every single day. And maybe even one in the morning and one at night until you no longer have Candida. Then just stay on one every day. Every day I take one number 1050 probiotic. That's 10 strains and 50 billion strength of a natural probiotic. And there's a list here of natural antibiotics that will help. So there's just a kombucha mushroom will help to reestablish the friendly bacteria in your stomach. And you can pick that up in any supermarket in any town. They have kombucha mushroom, little bottles of it. And you can sip on that, taking maybe 1 or 2 tablespoons before a meal, because it's just, it's going to reestablish your friendly bacteria. Gymnema sylvestre is an herb that is generally used when there's a problem with sugar levels. And people have Candida and overgrowth. And the Gymnema sylvestre is an herb that's currently generating a lot of excitement because Gymnema sylvestre is a tropical vine known as cow plant. And in an animal study published in the 2013 in the medical journal PLOS 1, Gymnema sylvestre not only was effective against Candida, but stopped the transition to the hyphal form by converting the fungus back into simple yeast cells, thereby demonstrating it could prevent and even reverse invasive candidiasis. Another plus for Gymnema It was effective against Aspergillus, another potentially dangerous fungal pathogen, while remaining completely non-toxic to human cells. Oregano oil is another tool that can be used against Candida because the phenols in oregano oil are highly concentrated and extremely effective in fighting bacterial infections, fungal infections, and Candida overgrowth. Oregano oil, wild organic oregano oil is known to be especially effective in fighting conditions like Candida. And you'd be taking 3 drops to 7 drops in a tablespoon of olive oil, and you'd be doing that 2 to 3 times a day until you no longer had Candida. Olive leaf extract is another remedy that's used by the body to fight fungal infections caused by Candida overgrowth. A high potency standardized olive leaf extract can obliterate Candida quite effectively. Pau d'Arco bark is another popular anti-Candida herb. Pau d'Arco is often brewed into a tea. Drinking 1 cup per day is an easy way to harness its antifungal properties. Garlic, neem, raw apple cider vinegar, echinacea, black walnut, organic unrefined coconut oil are all remedies for Candida albicans. We've come to the top of the hour. We need to get over to Prophet Elijah and get a closing prayer. And so let's get over to Prophet Elijah. Prophet Elijah, are you there, sir? And Prophet Elijah, are you there, sir?
I'm here.
Very good. I hear you 10 by 10. Please give us a closing prayer, sir.
Yes, sir. Isaiah chapter 38, verse 1. In those days, King Hezekiah of Judah became ill and was at the point of death. And Isaiah the prophet, the son of Amoz, came to him and said, Thus says the Most High, set your house in order, for you shall die and not live. Praise the Most High God for his power given to us through prayer. Many of the praying kings and the praying prophets were almighty forces in bringing deliverance and destroying the Most High God's enemies, which are also our enemies. Hezekiah was a man who had ministered in prayer, in destroying idolatry, and in reforming his kingdom, and in meeting his enemies. Prayer had been his chief weapon. Today, prayer is our chief and main weapon. Only prayer and speaking out loud with aggressive faith will change our purpose and snatch us from the jaws of death. Prayer can save man from an incurable disease. We must take back what the enemy has stolen from us concerning our finances, health, and relationships. Father, we turn our face to the wall and pray to you, saying, we beseech you, remember now how we have walked before you in truth and with a perfect heart and have done that which is good in your sight. Just like Hezekiah, I decree that the Most High have heard our prayer. He has seen our tears and will heal us from every infirmity like Hezekiah. He will add to our days 15 years plus. That's what you asked for. Thank you for healing us emotionally and physically from these experiences and help us to cleanse our mind. So be it. Dr. Birch, I decree that the confidence that you have in the Most High God is that when you ask anything according to his will, he hears you, and that you have the petitions that you desire. Father, Dr. Truman has cast the whole of his cares, anxiety, and all his worries and concern once and for all on you. You care for him affectionately and watchfully. You sustain him. You will never allow the consistently righteous to be made to slip, fall, or fail. Father, he delights himself in you every day. and you will perfect that which concerns him. He has cast down imagination, every high thing that exalts itself against the knowledge of you. He has laid aside every weight of worry. He runs with patience the race that is set before him, looking to Jesus, the author and the finisher of his faith. I thank you, Father, that you are able to keep that which Dr. Truman has committed to you. So be it. Were you blessed tonight by Discoveries in Health Ministry? If so, tell someone you know who may be blessed. Bless Dr. Brace in return. Pray about sowing into his ministry so that Dr. Brace may be able to keep this information offering like he did tonight freely to many who are listening here tonight. Dr. Brace, know that his time is not used in vain. Show him your appreciation for all that he does, whether it is in word or financial support or working is worthy of his hire, which is 2 hours of his time each week. Bless him, and I guarantee you shall be blessed in return. So be it.
All praises to the Most High. So be it.
All praises.
Thank you. Let's open up the microphones and over here in dial pad meetings. That's there we go. Unmuting all the microphones. All praises to the Most High, brothers and
All
sisters.
praises. All praises.
All praises.
Hallelujah.
All praises to the Most High.
All praises to the Most High. Thank you, Doctor.
Thank you, sir.
Prophet Elijah.
Appreciate it.
You're more than welcome.
Be blessed. Shalom.
Most High.
Shalom.